Bonsoir. Alors ce soir,
Good evening. So I would like to bring you 10,000 kilometers south to Le Havre in the Indian Ocean, Madagascar, the big island that this is called as well. Maybe you know that it's an island which has 25 million inhabitants, half of which have less than 20 years. So a young population, but it's also one of the poorest country in the world. There is no health insurance system, which means that for 9 citizens of Madagascar in 10 who work as a taxi driver or as farmers or peasants, in case of disease or in case of an accident, there is no health insurance. So in case of a disease, and they're wondering, how am I going to pay for my medical bills? How am I going to pay for the drugs? How am I going to pay for the blood tests? And this creates so much more anguish, as we know the average salary, which is only on average 45 euros per month only. And I would like to share with you one of my deepest beliefs. I would like that everybody in Madagascar has access to a health insurance system, and I'm going to show you how this is possible for only 10 euros per year per family. But before that, I would like to give you some background information on Madagascar. In 2009, there was a revolution. The mayor of Madagascar, he was a DJ, and he ruled over the president of Madagascar, and it created a dramatic situation. Since 2014, the situation has improved, and the new president is here and aims at implementing a new health insurance system for all. But there is still a lot of work to do. Access to health is still very complicated. A number of people renounce to treatment or wait for treatment because of lack of money. The financial issue is obviously the main issue, the main obstacle to care. They don't have enough money to get treated. On an island like Madagascar, Madagascar is as big as France, but the road network is a lot less developed. So the distance to the hospital or care facility is definitely a problem. For 2 Malgache in 10, you have to walk for at least 1 hour to get to a healthcare center. So on top of the financial problems, there is also the transportation problem, and those are major obstacles to healthcare. So one of the people we work with, his name is Germain, was in the face of very difficult, dire situation. He became ill. He had to go to the hospital, and the hospital bill represented 2 months of salary. And so he was faced with a type of question: should I sell my house? Should I sell my piece of land? And I have another example of a vanilla producer. He's in charge of a family of 8, and amongst those 8 people is a stepmother. She has a cardiac disease, and the hospital bill was 185 euros for the hospital bill. And that man, Germain, is wondering, how can I pay for the hospital bill of my stepmother? And he turned to the usury person in the village, and who gave him a loan with a 200% interest rate. And this happened at a moment where they were extremely vulnerable, at the moment where they do not sell the production of vanilla. So they need to sell the vanilla before the harvesting campaign is completed, and this really decreases their income. But as you know, vanilla in Madagascar is a major stake. You maybe know that Madagascar is the 4th producer of vanilla in the world. That's the Bourbon vanilla that we enjoy so much in our cakes and ice creams. A German company, which is called Symrise, is the fourth provider of aromas, and they work in Madagascar with 5,000 producers of vanillas. This company is faced with two main challenges or two main problems. The first challenge is that they have to meet a higher and increasing demand of vanilla in the world, and they have to provide vanilla to the giants of the agri-food industry like Unilever. And second difficulty is that they need to get loyal vanilla producers because they have to operate in an highly competitive market. So in the framework of the policy of social responsibility, they've tried to implement a value chain in the market of vanilla. And it was a threefold program. They wanted to improve the quality of life of vanilla producers, trying to tackle the questions of infrastructure, improvement on health, improvement of education. The second axis was to try and reduce the risk of vanilla before it is ripe, and therefore to try and reduce the loss of gains for the producer. And the third solution, the third avenue, was to try and have more loyal producers. And this is in this framework that our company or our association intervened. So Symrise asked Planet Guarantee to implement an healthcare system for the vanilla producers. So in a few words, Planet Guarantee, we are a council company. We are broker. We're doing brokerage in insurance, and we operate in Africa, but also in Asia and in Latin America. So we went in the field. We went in Madagascar. We met with the families. We visited hospitals. We conducted surveys and studies, and we realized that the solution was not that complex, and to say the least, the most important diseases were not very difficult to cure. Most of the time, there were diseases like diarrhea, acute respiratory diseases like sore throat or malaria. For this to be successful, we defined a number of items. First of all, the insurance product had to be simple, and it had to cover a number of healthcare products, so it had to cover the simplest cases to the most acute cases requiring a hospital stay. It had to cover the family in the exception that it has in Madagascar, so at least 7 people. So the spouse, number of children, and most of the time the respective parents of both spouses. And then the insurance product that we would select in our brokerage approach, we had to select a number of healthcare centers, but also of chemists with which we could have a trustful relation. And for it to be a commercial success, we had to do the right pricing. So this price was carefully defined, and today we have prices which ranged between 10 and 25 euros per year and per family only. So between 10 and 25 euros per year per family. Today, these private healthcare insurance are managed by a platform, a mutual platform in Antananarivo, in the capital of Madagascar, and it's comprised of healthcare professionals. So they are the warranty, the quality, and the professional level. Obviously, those healthcare insurance have changed the lives of many families. Today, there are 15,000 beneficiaries because 3,300 families have subscribed to those families. It changed the life of Tiogen. His daughter had to be operated for an appendicitis. The appendicitis operation costs 1,135 euros, and all the hospital bill was covered by the healthcare insurance. insurance. So this vanilla producer is highly satisfied by the service and, of course, is ready to renew his subscription next year. So you may tell me, well, this is all very nice and well, but can the system be replicated? Well, the answer is yes. First of all, we can tell that when we pool 1,000 families, paying a reduced amount of money in our European standards, we are able to propose an health insurance system to the many. There are a number of examples in India, in Bangladesh, with a number of microfinance structures or cooperatives. And not only is it replicable, but it is a positive system. It's positive for the families, because with families have a more direct access to healthcare. They avoid becoming impoverished. It's also positive for the healthcare centers, because it improves the cash flow and it improves it helps them, makes it possible for them to invest in medical equipment, to improve also a better offer in terms of healthcare. This is also a positive solution for the international organization, the buyer, the purchasers, because the producers are more loyal and they have a better quality of vanilla in this case, because that way they keep their customer. It's also very positive for the government, because such initiatives are pioneer in their area, and we can envisage to have a universal healthcare system. This is something that is that can be envisaged. So, if like me now, you're convinced that everybody should benefit from this universal healthcare insurance system, I would like you to participate to all our initiative. Planet Guarantee has launched a participative project to implement a universal healthcare system in Moroni, in the Ivory Coast. This project is available on the Anaxago crowdfunding system. So I hope tonight that I convinced you to become an actor of universal system by voting and investing on the link that is here on the website for Anaxago, for our association called Planet Guarantee. I thank you so much for your attention.